This week on Healthy Living, children ages 5 to 11 in the U.S. are receiving the COVID-19 vaccine. We'll have more. Is the COVID-19 vaccine safe for young children? An expert discusses what you need to know. And how much water should you drink every day? The answer coming up. Plus, assessing Zimbabwe's progress in maternal, newborn, and children's health. These stories and more in this edition of Healthy Living. Hello, I'm Lina Khmudu. Thank you for joining us on Healthy Living. Young children in the United States are lining up to receive the COVID-19 vaccine. The U.S. Food and Drug Administration recently granted emergency use authorization for Pfizer-BioNTech's mRNA COVID-19 vaccine for children 5 to 11 years of age. According to the U.S. Centers for Disease Control and Prevention, fewer children have been sick with COVID-19 compared to adults, and most children with the disease have mild symptoms or they may have no symptoms at all. However, they can develop multi-system inflammatory syndrome, a potentially severe and dangerous complication that causes inflammation of vital organs. Here in the United States, some parents are taking the step to keep COVID-19 away from their children. VOA's Begum Domes Ersos has more from a vaccination center in Fairfax, Virginia, outside of Washington.
Children in America can now get their first COVID-19 vaccines at centers like this one in Fairfax, Virginia. Earlier this month, the U.S. Centers for Disease Control approved a recommendation that children between 5 and 11 years old receive a pediatric dose of the Pfizer-BioNTech vaccine. Now, the first of some 28 million eligible children in America are taking their first dose.
It doesn't even hurt. I thought it was over when, like 5 minutes after. I felt a little bit of it, but it didn't hurt.
Pfizer-BioNTech says the vaccine is about 91% effective in this age group. Children aged 5 to 11 receive 1/3 of the dose provided to adults and other children over the age of 12. The dose amount is said to be powerful enough to trigger a strong immunological response while being low enough to avoid unwanted side effects. But some parents still aren't sure about following the recommendation. According to a 10-day study by the Kaiser Family Foundation in October, nearly 1/3 of parents with children between 5 and 11 said they plan to wait and see before having their children vaccinated.
I guess I would say do your research. I think it's safer to get the vaccine than not to personally, but that's me. I don't want my kids getting COVID, so I feel good that we're on our way to being fully vaccinated.
Nearly 84% of Fairfax County residents have received at least one dose of the COVID vaccine. There is currently no data available for children between 5 to 11 years old.
Dr. Jessica Nash is a pediatrician at Children's Hospital in Washington, D.C. She tells us more about the COVID-19 vaccination for children.
It seems with this second wave, with the Delta variant, we started to see more kids sick. So this has been an exciting time to offer some protection to a population that could potentially get sick with the coronavirus. The clinical trials showed that this age range between 5 and 11 only needed about 1/3 of the dose of what we gave adults, no matter what their age was between this 5 and 11. So it's really not related to what your size is at 5 or what your size is at 11, but it's about what the immune response was in this age population. So there is some confusion around, like, so should I wait till my kid turns 12 so they can get the vaccine, the dose amount for the 12-year-olds, or will it be enough if they are just 11? And so that part doesn't matter. What really is important is that the immune response that kids have with the dosage at 1/3 is adequate enough no matter what, for the ages between 5 and 11. You do get some immunity, or what we call natural immunity, with getting the actual virus. So if you test positive and you have the virus, then you will have some natural immunity. The concern is that immunity wanes faster than if you get the actual vaccine. Where the booster shot came in place is that we found, and in particular, this was really the older adults and those with who were immune compromised, that after several months, their immunity started to wane, and that they needed an additional vaccine so they can have more of the immunity against the coronavirus. You know, the FDA said that we're not going to let Pfizer take any shortcuts when it comes to the clinical trials for this vaccine. The great thing about the study for the 5 to 11-year-olds, that there were no serious side effects or harms noted, which is excellent, which is actually different for what we saw for the older age populations. And usually when we're looking for side effects, typically they tend to happen in the first couple of weeks, first couple of months. And we are, with the clinical trials, we are beyond that first month. We're beyond that 2 months where we would be looking for where if there were serious side effects that they would show. And the clinical trials showed that there were no serious harm or effects to kids. When you receive a vaccine, your body is mounting an immune response. And what that means is your body is recognizing that there's something there that we want the immune system to recognize. And so you could get a fever, or some people, just like adults, kids may be a little tired for a couple of hours after the vaccine. Just like with adults, they get one dose and then 3 weeks later, they're supposed to get their second dose of vaccination. The best protection that we can offer is to get the kids a vaccine, like the COVID-19 vaccine, especially now that we are putting our kids at higher risk by having them in school. If you have a child who has some type of complex medical issue, most likely the specialist is recommending that they get the vaccine because they're at even higher risk. And if there's ever any question or concern, that would definitely be something to talk to your pediatrician or the specialist that is seeing you. But as we're seeing kids in the office, kids with asthma, kids with congenital heart disease, kids with sickle cell disease, especially kids who are immunocompromised, have been referred by their specialist to get the vaccine. And unfortunately, you can have a co-infection of flu and coronavirus, COVID-19. Which can put you at even higher risk of having a more serious illness. So we just want to encourage parents. We know it seems like a lot, but this is what we do. Preventative medicine is what we do best in pediatrics to keep our kids safe. And we want to continue to do that.
We asked some parents in the African community here in the U.S. if they plan to vaccinate their young children against COVID-19. Here is what some of them had to say.
I think if we are in such a hurry to send them back to school, they're less likely to, practice social distancing and make sure they're being as sanitary, washing their hands. So it's important that they have that level of, protection, like through the vaccine, to safeguard them from, this microscopic killer, which is COVID-19. I myself am vaccinated. I had COVID, and so it's not fun, and I definitely would not want a child or anybody else to have to go through it.
So as a parent, I just feel like it's too new to feel confident in the vaccine for anybody. That's adults and children. But we'll see. My daughter is scheduled to be vaccinated, and my son, he doesn't like needles, and I'm not going to force him. I believe it's safe. What I don't think is as effective as they're marketing it. So that's the thing. Is it safe? Yes. But is it as effective as we would like it to be? Probably not. Because if it was, we wouldn't need boosters.
I don't fully really think that it's entirely safe, honestly, because, we're still, the pandemic's only been going on. It hasn't even been a full 2 to 3 years yet. So, there's still a lot of uncertainties that goes with, the vaccine. And there are people who are vaccinated who are still contracting the virus and still dying. I personally wouldn't recommend having my child vaccinated, but at the same time, I guess other people may do what they will do for their kids. So, you can't really stop people from doing what they want to do. But me personally, I wouldn't have my child vaccinated if I did have a child.
It's safe for the children to have the vaccine because, number one, it helps to protect them from school so they can go to school. Because other kids might have underlying conditions and stuff. So for them to have a vaccine at the age of 5 to 11 years old and up, To me, I think it's safer and it's a great thing. Therefore, if they don't get sick from the vaccine, and so far the children are not getting sick, but to get a COVID and then infect other children might have an underlying condition. So for every one of them to have a vaccine, yes, they are children, but it's safer for them. That's why the dose has been reduced. And me being a parent, I have 3 children, they all have been vaccinated.
Did you know that water makes up 50 to 70% of our body weight? Experts say we lose water through perspiration, urine, breath, and bowel movements, and the body depends on water to survive. So are you getting enough H2O? You may have heard that drinking 8 glasses of water a day is a good idea. According to US-based Mayo Clinic, most healthy people can keep themselves hydrated by drinking water and other fluids whenever they are thirsty. For others, less than 8 glasses per day may be sufficient, but some, on the other hand, may require more. The National Academies of Sciences, Engineering, and Medicine in the U.S. recommends men should drink about 15.5 cups or 3.7 liters of liquids every day, and women should drink about 11.5 cups or 2.7 liters of fluid every day. These guidelines apply to fluids such as water, other beverages, and meals. So go ahead and make sure you stay hydrated. Dr. Abubakar Campo, UNICEF's Director of Health Programs, spent a week in Zimbabwe to assess the progress of country's maternal, newborn, and children's health systems nearly 10 years after the UN agency injected millions of dollars into them. Columbus Mavunga reports from Mount Darwin, Zimbabwe.
Belinda Kaziwisi is from Mount Darwin, Zimbabwe, which is near the Mozambique border, about 200 kilometers north of Harare. She's one of the Zimbabwean mothers seeing the benefits that have grown from money provided by UNICEF.
From the time I got pregnant until the delivery of my child, I didn't pay anything. When I delivered, I was given soap, cotton, and other things for free. It was all nice compared to what used to happen before.
With funding from UNICEF, the Zimbabwe government has hired health workers who encourage pregnant mothers in rural villages to seek assistance from the country's health institutions to avoid complications.
We tell them, the journey to the delivery of your baby can be so easy. Your baby will be taken care of even while in the tummy. Since there are now so many diseases, if they do not come to clinic, the baby may be delivered with illnesses. That's how we encourage them to come to the clinic.
Dr. Tajudini Oyewale, the UNICEF representative in Zimbabwe, says having health workers in rural villages and funding the country's health sector are both paying off.
And when you look back at the latest result of the multiple indicator cluster survey, Zimbabwe has successfully halved maternal mortality ratio in the last 10 years. And this is a combination of different efforts of everyone. The challenges are real because the world is evolving.
UNICEF's Campo was a junior official in Zimbabwe for the UN agency when it launched the Health Transition Fund, a multi-donor pooled fund to support the country's barely functioning health sector in 2012. This week, Campo has been in Zimbabwe to assess whether the fund has changed Zimbabwe's maternal, newborn, and child health systems. He says the fund is bearing fruits.
And I'm very pleased with the progress which Zimbabwe has made in terms of providing health services to their entire populations. It is not perfect, but I think Zimbabwe can be proud of the achievement made.
The Mali national said Zimbabwe now has a fully functional health system in primary health care, a sharp contrast to what the nation had nearly a decade ago.
For the latest news and coverage on the coronavirus, stay connected to Voice of America at voanews.com. You can follow me on Twitter at Linoch Mudu. That's our show for today. Until next time, stay well and strive to make every day a healthy day.